From the COVID-19 daily data, you may hear about deaths being confirmed from weeks or even months ago.
Fox 13's Brian Schnee spoke with the state's chief medical examiner about the backlog of COVID-related deaths. It is a story you will only see here.
Along with healthcare workers and other professions being bogged down during parts of the pandemic, the state of Utah's medical examiner's office has been trying to push through drastic increases of their own.
We have, been involved in the investigation of, every death from COVID in the state.
Dr. Eric Christensen says that under state law, all deaths that result from public health importance fall under their jurisdiction. So when a surge in cases took place during the last year, the busier they got.
It's something that we're in the habit of doing. It's just not to this volume.
At one point, there were roughly 250 backlogged cases they were investigating. Now they're down to 160 or so, with a third of those awaiting test results before final determinations are made. Dr. Christensen says the backlog has improved over the last few weeks as overall case numbers have begun declining in the state.
It's not ever a difficulty in making the decision. It's just a matter of getting documentation.
Of the nearly 2,000 COVID-19 related deaths here in the state of Utah, only 8% or so required an autopsy, which is less than 200 people. In fact, the term backlog is less about bodies themselves and more about paperwork. The medical examiner's office investigates each death while trying to track down additional records or reports that can sometimes take months to obtain, thus resulting a delay of a reported death.
The numbers that get reported every day are numbers, but as we go through the individual files, it's pretty clear that these are people, that there is a story and a family attached to every single one of these numbers that gets reported.
Whether it's COVID-19 related or not, Dr. Christensen says deaths in the state of Utah have increased significantly from year to year, with death examinations alone increasing by 16%.
It's been busy, and certainly not all due to COVID. There are certainly a lot of, we've seen a large increase in the number of deaths that have come through here. Some directly attributable to COVID, but the majority not.
Aside from population increase and taking COVID-19 into account, it's unknown exactly why there have been a steady increase in deaths. But as it pertains to the pandemic,
the stories in many cases are strikingly similar, sadly so.
The medical examiner's office will keep chipping away at its backlog, and they've been reminded all too often this past year that each death is much more than just a reported number.
It's really been heartbreaking, frankly.
Brian Schnee, Fox 13 News, Utah.